I was 17 years old, sitting in my high school chemistry class, trying to shrink into my chair and pray that nobody would notice my newly permed, awful hair. If you remember the 70s, you know exactly what I'm talking about. Chemistry class was not my favorite. It was really hard to concentrate on the periodic table when I had much more important things on my mind, like my future. I was staring out the window and hoping today would be the day I found that letter in my mailbox. There it was. I got home. Mom was waiting on the porch, holding that letter in her hand. Julie, it's here. Let's open it. You see, my mom had always dreamed of being a nurse. She passed that dream to me. And now I was officially going to nursing school. I've been a nurse for 45 years now, and I've seen my fair share of patients dying from cancer, from heart disease, and car accidents. But I had no idea how many patients die from something entirely preventable. Medical error has been declared the third leading cause of death. Isn't that shocking? I don't know about you, but I knew heart disease was number one and cancer was the number two cause of death. But medical error, the third leading cause of death? So to put this in perspective, that is the equivalent of 2 Boeing 737s crashing every single day and everyone on board dying, no survivors. I decided to pursue my doctoral degree so that I could research this problem of preventable patient harm. And I was surprised to find that 70% of patient harm events are due to communication breakdowns. So the patient care team really is 2 vital parts. We have the medical team with the doctors and the nurses, and then we have the patient's family. It's vital that these 2 patient care teams work together to prevent communication breakdowns that actually contribute to killing patients. I'm going to teach you that tool today. The idea we're sharing, the preventing patient harm, requires that genuine partnership between the healthcare team and patients' families. I was on the other side. I found myself being a patient's family member and not the nurse. I got a call from my brother who said, Julie, you probably better sit down. Mom and Dad crashed their airplane flying home from Grandma's house. They're in critical condition, but they're alive. I was stunned. That was a call I was never expecting. It was difficult because I was living across the country with my family, my children, and working a full-time job in the ICU. I couldn't be there with my family at their bedside. I relied on communication from the healthcare team, which was very limited. They decided, we had a big family, that they would only talk to one of us. They chose my brother. For some reason, I don't know why, he had no medical background. He didn't even understand half of what they were telling him. One day he called in a panic and he said, Mom thinks the guy trying to draw her blood is trying to kill her. Well, I knew exactly what was going on. My mother wasn't crazy. She had what we call ICU delirium, which is when the constant lights and beeping of the monitors and the alarms and the noises in the ICU disrupt the patient's sleeping patterns, and they can hallucinate. Luckily, my parents did survive this event, but the challenge with the communication with the team left me feeling like I wanted to do something about this and make a difference. So I decided to go and teach nursing students at the local university. I had a blast. The students learned from my experiences, and I helped them connect the dots between what they learned in the classroom and then how they took care of patients. One of the challenges I discovered was in the simulation lab when the students had to call the physician and pick up the phone and tell them about the changes in the patient's condition. They were terrified. They didn't want to call and speak to the doctor. And I thought, we've got a problem here. If nurses don't feel comfortable calling and talking to the physician, then we need to fix that. I discovered a tool called the CUSS words. So you, when you're faced with a situation of a loved one in the hospital, that you can remember these words. C stands for concerned. U, I'm uncomfortable. S, I'm scared. And S, there's a safety issue. Today, I'm going to tell you 3 stories of patients that suffered harm at the hands of the healthcare system. Maybe if their families had known about this tool that would help them communicate with the healthcare team, I don't know, maybe we'd have a different outcome. Lewis was a 15-year-old boy who went to surgery to fix a chest deformity that he was born with. The surgery went just fine. The following day, Lewis started complaining of abdominal pain. The pain intensified. The following day found him even sicker. His hands and feet were cold. His lips were pale. His heart was beating too fast. And now his belly was distended. 30 hours after the abdominal pain began, Lewis said to his mother, the last thing he ever said, "It's going black." The code blue lasted 90 minutes, but they could not revive Lewis. It was too late. On autopsy, they found 3 liters of blood in his abdomen from a perforated ulcer that was caused from his pain medication. Visualize yourself in this situation and use your CUSS words. You could say, "I'm concerned. Something is really wrong with my son. I need you to get the doctor in here to help him." Can you imagine losing a child, let alone to medical harm? And then there's Charles. Charles was a father, a master trainer, and an author who fell off his meditation seat. He and his wife thought it was kind of funny until they figured out that he had some bleeding in his brain. Charles needed to have surgery to relieve that pressure in his brain. A couple of days following surgery, he started having bouts of anxiety. His left lower leg pain and his left side became numb. He continued to deteriorate. He now was short of breath, and then Charles had a seizure. They rushed him to the ICU, but it was too late. Charles died of a preventable blood clot that traveled from his leg to his lung and cut off the blood supply and the oxygen to his vital organs. If you found yourself in a similar situation where your loved one is changing before your eyes, imagine yourself saying, "I'm uncomfortable. Something is wrong with my husband. We need to get the doctor in here to help him right now." Then we have Christopher, a 27-year-old son and father of 2 beautiful daughters who suffered a critical head injury in a car accident. He was recovering from the surgery and was actually improving. Christopher was weaned off the ventilator and was now breathing on his own. Day 18, Christopher began to deteriorate. His heart rate started climbing, his heart was beating too fast, and his oxygen was dropping. They got an arterial blood gas test, which showed Christopher had not been breathing properly for the last 12 hours. Shortly thereafter, he went into cardiac arrest and passed away. They could not revive him. If you find yourself in a situation with a son or a family member, remember your CUSS words. "I'm scared. This is a safety issue." His parents were devastated after he passed away. Their son had been improving. How was he now dead? They found that his pain medication and anxiety medication had not been decreased when he was weaned off the ventilator. He was over-medicated and sedated, his breathing too slow, which contributed to his death. They also found on autopsy that the trach tube that he'd been breathing through tore a small hole in his trachea, and that's why he was not breathing well for the last 12 hours. It was likely from the repositioning that they did in the morning when they put the chest X-ray plate behind him. If you find yourself using the CUSS words, and you don't see anyone taking action and you are still concerned, follow the chain of command and advocate for your loved one and your family member. The charge nurse is the next in the hospital chain of command. After that, the house supervisor. And then we have the administrator on call. They cover nights and weekends too, so they should always be available. Partnering to prevent patient harm is the way that we can decrease these events happening to our loved ones and our family members. Patients must remember and use the CUSS words. Healthcare providers must acknowledge the patient's family member and the patient, truly listen and act. In the words of Margaret Mead, as she so wisely said, never doubt that a few caring people can't change the world, for indeed, that's all who ever have. Thank you.